Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And we're glad to see you. I hope all is well in your households. And I hope that you are still caring for yourselves and being cautious. We are glad to know that the pandemic is coming to, shall we say, a low ebb, but just be cautious. Today we have a wonderful topic. It's the Crohn's and Colitis Foundation and colorectal surgery interests. And we have a very, very important and new member to our, in quotes, medical community. When I say new, she's been out there training in residency programs for well over 8 years, but is a member of the JFK Medical Center in Palm Beach, and that's Dr. Juliet June Ray MD, M.S.P.H. So obviously, Dr. Ray, you're going to tell us what M.S.P.H. is. I know what it is, but tell the people.
So it's a Master's in Science in Public Health.
Right, which is very important in today's world. Any large portion of our population that's involved with any disease entity really needs the advice and consent of metrics and details that come to you through the application of knowledge in public health to your own trained knowledge as a physician, correct? Correct. Okay. So, Dr. Juliet June Ray, doctor, you're a colon and rectal surgical, in quotes, expert. So tell us about your position and what you are involved with at Palm Beach Colorectal Surgery Unit at JFK.
Thank you, and thank you so much for having me. So colorectal surgery is a subspecialty of general surgery that focuses on the GI tract. Mostly, it's a bit of a misnomer actually, because we take care of the small bowel all the way, including the large intestine, rectum, and anus. So we care for a wide variety of diseases, so both benign and malignant or cancer type diseases. And we take care of acute problems, even emergencies like perforations, and more chronic diseases like cancer and inflammatory bowel disease that we're going to talk about more today. So I'm new to JFK. I completed my residency at the University of Miami Jackson Memorial Hospital for 7 years in general surgery. And then I just did a year of fellowship focusing on inflammatory bowel disease at New York University. And I'm down here now in practice.
Tell us about this this whole issue of what is Crohn's and what is colitis. Tell us.
Right. So inflammatory bowel disease is really an umbrella term that encompasses both Crohn's disease and ulcerative colitis. So both of these are chronic inflammatory conditions that cause damage to the gastrointestinal tract. So one kind of important differentiation, if you're looking at things in the most simplistic terms between Crohn's and ulcerative colitis, is that Crohn's really affects the entire GI tract. So we say mouth to anus, meaning you can have problems starting with the mouth all the way down through the upper GI tract or the small intestine, down to the colon, and even perianal conditions. Ulcerative colitis, on the other hand, really affects mostly the colon. And in addition to that, both of these conditions can have what we call extraintestinal manifestations. So inflammatory conditions that affect other parts of the body, such as the joints, eyes, mouth, mucous membranes, and things like that. So they really are complex diseases that are multifactorial in etiology, meaning we don't know exactly what the trigger is that causes these. We think there is some genetic component, environmental component, immunologic component for sure. And it is that, multifactorial aspect that makes kind of treating these diseases very complex.
We've been doing this program now almost 22 years, and the reason why we have interest, obviously we have a specific interest in the Crohn's and Colitis Foundation because of our relationship with Nova Southeastern, but we get a lot of questions or comments from our viewers, and that's why we create a programmatic structure so that we can get answers. And one of the things that we hear often, and it's not related to, in quotes, just the mature or elderly community, which we have such a large number in Florida, and particularly South Florida. But we have these issues where people have asked us questions, and maybe we'll cover it during this show. Everything from inappropriate digestive qualities, the cramping of the abdominal feelings, flatulence, issues related to hemorrhoidal issues. So I want to get, I know these are oversimplistic in a sense, but yet they're very complex relative to the way you have to approach them. So why don't we talk about some of these things? And I'm turning it right over to you, Dr. Ray.
Okay. Well, I guess in terms of inflammatory bowel disease, it actually 1.6 million people in the U.S. are diagnosed with this condition. So it's actually, more common than you may think. And the average age is usually under age 35. So, in a population of people that's normally young and healthy, this can be, the first kind of presentation can be with symptoms of inflammatory bowel disease. So what makes the disease is very, complicated is that the range of symptoms is very large. So for example, with ulcerative colitis, a patient may present with diarrhea, abdominal cramping, bloody bowel movements, problems related to the colon. With Crohn's disease, they can have, strictures causing obstructions and present with nausea, vomiting, or they can have abscesses and fistulas in the perianal region. So there really is no one symptom or, sign that a patient can look for. But I think the most important thing I would advise in terms of when to kind of seek medical care, or when to kind of start thinking about these things, is when you notice a change in your symptoms or a change in your bowel habits. For example, new blood in the stool, or a new cramping, or new nausea, vomiting, those kind of things.
Okay. Katie, you're the executive director of the Crohn's and Colitis Foundation. Why don't we talk about the Crohn's and Colitis Foundation?
Well, thank you so much. And again, thank you for inviting me to be here, because this is a great opportunity for me to really kind of talk about the foundation a little bit. Because one of the things that upsets me, I think, the most is when we meet a new patient, or a new patient comes to us through one of our events, or they just happen to see something and they say, oh my gosh, I didn't know you existed. I didn't know you were there. So the foundation has actually been around since 1967. And our mission is twofold. First and foremost, to find a cure for Crohn's disease and ulcerative colitis. And as Dr. Ray so eloquently pointed out, they're two very complex conditions. And what the foundation has discovered over the years is that there's, just as different as the disease presents in each patient, that there's probably not going to be one cure for it. So it's going to be a point of determining what type of Crohn's disease, to simplify it, and then adjusting your treatment based on the type of disease that you have for Crohn's and for ulcerative colitis. But the second part of our mission is while we're waiting for that elusive cure and doing the research, is to improve the quality of life of children and adults who are suffering from the disease. So we are, we focus on research, and the way we fund our research is through our fundraising efforts. So we have different events around the state of Florida, which our chapter is one of 35 across the country. We also, in addition to funding the research, and since our inception, the foundation has funded over $400 million worth of research in Crohn's disease and ulcerative colitis, and has been in the forefront and been involved in every major discovery that has happened. So we're really kind of proud of that. In addition to that, the fundraising that we do is also done to help support the support groups that we have, the education programs that we run. One of the wonderful things that the foundation funds is our Camp Oasis program, because, well, as difficult as it is for an adult to struggle with a disease, it's even more complicated and difficult for a child. So we've created this wonderful camp called Camp Oasis, which is really it's for kids. It's a sleepaway camp, 7 days. It's a medical-based camp. but it's really created to kind of make them feel like they are quote unquote normal. They do all the normal camp things that kids do at a sleepaway camp, but it's in an environment where, those kids who need to have their infusion medications and their daily medications, and some of them are hooked up to IVs and some of them are not. But it also is, as I'm sure Dr. Ray can talk to as well, is that it's we like to think that that it's truly a mind, body, spirit disease, and one of the things that's really I think probably that makes me feel the worst for the patients that have it, especially the kids, is that they will say, well, you don't look sick, because on the outside they might not look sick. So, but inside they're really having a difficult time. So in the nature of the disease is not one that people openly talk about, the majority of people. So it does make it challenging, and psychosocial issues, in addition to all of the other intertestinal, issues that Dr. Ray, spoke about. So.
Well, you say they don't talk about it because a lot of times the patients that are affected, the people that are affected, are embarrassed.
Correct. I mean, absolutely. Yeah, and even even for someone, an adult who, let's say, I mean, there are some patients who actually go, have bowel movements up to 25 to 30 times a day. So imagine trying to work in an office and having to literally run to the bathroom, every 20, 30, 40 minutes. It gets very, it's difficult, and it's also very isolating. Might not want to go. We've had patients who say, gosh, I could never go on an airplane ride unless, because I might get caught and have to sit in the restroom on an airplane or on a car ride. So, as much as it does affect the body, and Dr. Ray knows, can speak to that as well, how debilitating it can be internally and externally, it really does affect the psychological side of things for many of our patients as well. So that's where I like to think that we're making, in addition to the research, that we're really helping to make an impact, not just for the patients, but for their families, because it is a family disease, and their families and their caregivers and everybody else that they happen to come in contact with.
Dr. Ray, there's an answer to a lot of this. There's so many new applications of medications and surgical techniques that will help them. Can we talk a bit about that?
Yeah, for sure. I mean, as complex and, debilitating as the disease is, we do have a lot of good treatments. But one thing that, patients and the public really needs to understand is that these conditions are chronic and they require lifelong treatment. And where patients really can get into trouble is if they kind of fall out of the care of a specialist. And that often happens, and patients will present with complications. So in terms of the medical management, these patients have to be very closely followed by a gastroenterologist who can prescribe those medications that they usually need to be on in a chronic setting. When it comes to surgery, I think it's really important to note that about a third of patients with ulcerative colitis after 30 years of having the disease actually need surgery. So that's, a huge percentage. And it's even worse with Crohn's disease. Crohn's patients, about 2/3 of patients, or 70%, will need surgery at least once in their lifetime. And most Crohn's patients actually need more than one surgery. So if you can think about the impact that has on the patient in terms of being on chronic medications, and then on top of that, having to go through surgery and recover from surgery, it really is a lifelong, debilitating condition. And that's why having the foundation is so important, to provide that support to patients and guidance to get to the right providers, and also, the social support to get through all this treatment.
In a long time ago, my first profession was pharmacy, and I owned retail pharmacies. And I'm totally amazed today as I walk through either our pharmacy here at Nova Southeastern or the various entities that are around us, whether it be CVS or Walgreens or independent pharmacies, the number of over-the-counter preparations that are cited by their labels to be palliative for hemorrhoidal and rectal problems. It amazes me as to the number that are out there. I'm just wondering, hopefully, that our viewers who are having some of these problems do not mitigate the need to see professionals like yourself, because there is not only hope, but care and cure. True?
Mm-hmm. Very true. And I think, one problem with having so many options available over the counter, they may actually, mask symptoms. So I've treated a lot of patients recently who have, quote unquote, failed medical management for hemorrhoids over the last year. And I've actually seen something abnormal on exam, taken them for biopsy and found cancers, either squamous cell cancers, melanomas, fistulas, other abnormalities that had been, masked. So I think if you do have a prolonged symptom, you should definitely seek care from a specialist and just get a professional opinion.
The purpose of having you appear today is to certify the fact that there is an opportunity for them, patients, people who are viewing us, to see physicians who are highly skilled and qualified like yourself to help them through these problems.
Yeah, I mean, one thing to know as a patient is that, when you are diagnosed with inflammatory bowel disease, you will formulate a very close relationship with both your gastroenterologist and your colorectal surgeon. And it's very important that you choose a provider that you really, can establish that relationship with, because you are going to be followed chronically. And we have to keep track of you and know how you're responding to treatment and when you may be failing treatment and need surgery. So although these drugs, like you mentioned, they're serious medications and they have serious side effects, a lot of discussion will go on prior to initiating you on one of those medications with your gastroenterologist, appropriate testing to make sure that it's the right medication for you, and going over the side effects and the risks so that you can choose the right treatment plan. On top of that, hopefully as an inflammatory bowel disease patient, you will meet a colorectal surgeon early before you need one in an emergency setting, so that we can work with you. And as your symptoms change, or if you're starting to respond or not respond to particular medication, we can intervene early, where perhaps minimally invasive surgical techniques can be used in a safe, planned, optimized operation, as opposed to having to come in on the tail end once an emergency happens. So that's always our goal, is to work in a multidisciplinary fashion with the gastroenterologist, the primary care, any other specialists taking care of that patient, and establish that relationship early.
We got a question from one of our viewers. Well, it was really a statement. They were offered multiple antibiotic treatments for what was presumed to be a bacterial or infection, and yet what happens is, and I'm not playing doctor, I'm just repeating that what they're saying, that what happened is they created such an imbalance that it created more of a problem than the initial problem.
Yeah, so there's definitely a lot of emerging research in the field of colorectal surgery involving the microbiome. So what that means is the balance of good and bad bacteria that live in the intestine. And there are theories that, diminishing the good bacteria with antibiotics can lead to, an overgrowth of other bacteria, an imbalance of different bacteria, and that can cause problems. We certainly know that's true in, for example, C. difficile infections, which is common in hospitalized patients that receive, a lot of antibiotics. So, although there is research in that field, I don't think we have exact definitive answers as to what is the good bacteria, what is the bad bacteria, what's the optimal balance of this, or how we can treat, those things. But I think it should be noted that especially in inflammatory bowel disease and even colorectal cancer, there is evidence that the microbiome does play a role.
Keohane, do a lot of those questions come up at your various conferences or meetings that you have for the public?
Yes, they do. And in fact, the microbiome plays a huge part in the research that we've done, on Crohn's disease and ulcerative colitis. We know that patients who have IBD, their microbiome is different from those patients that don't. And the overuse of antibiotics is, you talked earlier, Dr. Dr. Ray about environmental factors playing a part in it. And that is one of the studies that we've looked at, as well as other environmental factors. So yeah, and I think the biggest question people have at education programs is, especially if they can't find a family history of the diseases, like why do I have this? What causes it? I think it's just intrinsic in people to see if they can figure out what caused it, then maybe they think they could have avoided it. But sometimes it's just, and I think the research that the foundation is doing and continues to do is illustrating different factors that are playing a part of it. But, genetics is a part of it. The microbiome is a big piece of it. And the environmental factors, the environmental triggers. And in addition to, I'd just like to piggyback on what Dr. Ray said as well about how important it is to see your GI and loop in your colorectal surgeon in the beginning and have them be part of that integrative team, so that if you do have an emergency, it isn't the first time you see your surgeon. And I think in addition, including a nutritionist and a psychologist at the same time to really treat the whole patient, which I think is really important.
Dr. Ray, I want to just one more thing, and that is I want to underscore again that your knowledge needs to be spread throughout your medical community that you work with, and through your Palm Beach colorectal surgical unit at JFK. I want to thank you both for being here today. We're down to the last minute and 45 seconds of this show. But, there's a lot of folks out there that are affected by the colon and rectal issues. And we want them to know that you're there, not only to help them get the medical attention, but also to get the shall we say, as you said, Katie, the mind, body, spirit inculcation within their lives. So we thank you both for being here. Dr. Juliet June Ray, thank you very much and good luck in your new endeavor at JFK Medical Center. And stay in touch with us. Anything that we can do for you, let us know. And for you, Katie Cohen, what can I tell you? We've had a long relationship with Crohn's and Colitis Foundation. Anything that we can do to make it even greater, all you have to do is ask. So folks, we want to thank you very much for your questions. I hope this gave you some insight. We didn't do any technical, shall we say, recitation, although I don't want to in any way demean what Dr. Ray presented, but be aware of the fact that there are people out there that do have the knowledge that can be helpful to you. Don't be ashamed. Don't stress yourselves beyond your capacity to seek help. Reach out. So as I always say to all of our viewers, you got to take good care of yourself. Remember, this show is your show. So if you have any comments, you have any questions, there's an email address and a telephone number right here. Just give us a call or send us an email, and we'll get someone to give you an answer. We won't do the answers. We'll let the experts give you the answers. And remember, as I always say, your good health is in your hands as well as your physician's hands. This program is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see you.